Medical terminology knowledge is important for healthcare workers. It is important for understanding the meaning of terms used in documentation and to be able to discuss them with patients. This presentation is going to show you what I've learned in this class. In session 1, I wrote that medication errors are one of the common errors in the medical field that can result in harm or death. I discussed how the use of electronic prescribing systems can help to alleviate the issues with handwritten prescriptions and/or orders. Yusuf and Yusuf of 2017 noted that physician entry of prescriptions on a computer reduces transcription errors and shows potentially problematic prescriptions. For instance, it shows an improper dose being prescribed on a drug that might interact with another medication taken by the patient. An electronic prescribing system may also help identify look-alike and sound-alike medications and flag them to match the diagnosis. In session 2, I reflected on what personality traits I have that help in my nursing career. I have a strong need to care for others. I currently work in clinical research, which has allowed me to provide care to patients in a whole new way. I'm able to help provide them with the new up-and-coming medications. This is often helpful because many of my patients would not be able to afford the medications otherwise. I also have good ethics that allow me to be honest and follow the rules of the job. I do this with a biblical worldview. I am also able to communicate well with those that I work with. This is also an area that I have to be careful with because I can be too honest at times and coworkers can have their feelings hurt. Session 3, we were given a scenario of a busy, overworked nurse that forgot to document a pain medication given. That resulted in the patient getting an extra dose and having complications. We were to discuss if we would notify our supervisor that the medication was given and not documented, even though the patient was okay. I discussed that it is my responsibility as a nurse to report any error or mistake that occurred during my shift, whether a patient was harmed or not. These moments can also oftentimes be used as teaching moments. In that scenario, the nurse would be reminded to take the time to make sure everything was documented. In session 4, I interviewed a coworker that is a nurse working in rheumatology at Austin Regional Clinic. She told me about the many different medical terms that she uses on a daily basis, such as arthritis, rheumatology, autoimmune disorder, osteoarthritis, scleroderma, sicca, iritis, uveitis, psoriatic, gout, etc. It goes on. She also discussed the importance of knowing what the medical terms mean so that she can explain them to patients that do not have medical knowledge for better understanding. She told me about witnessing mistakes. She was shadowing a nurse that she had distributed all of his medications into their cups and placed them in a drawer in the medication cart. He did not put any identifying marks on the cups, and she felt that he was blindly passing out medications. This made her very uncomfortable, and she went to her instructor and discussed how unsafe it was. I found this story to be very interesting because I've also worked in long-term care nursing, and I understand how busy it can be, but this type of nursing should never be allowed. We also discussed what assets she has that are important for the team. She mentioned having a competitive personality. I thought this was interesting because I also tend to have a competitive side, but never found that to be an asset for the job. She described how it helps her to be pushed to go above and beyond for her patients and to stay on task so that she can accommodate the inevitable curveball. Plans for the future. My plan for the future is to continue to use my knowledge of medical terminology in the clinical research field. I plan to move on to a CRO or pharmaceutical company and grow my career from there. I enjoy the clinical research field a lot, and I love that I'm contributing to advancing our healthcare. In conclusion, medical terminology is important in healthcare in order to understand documentation and be able to discuss terms with patients. Proper documentation is important for patient safety. This is especially important when writing medication orders. Nurses will work well when they are caring, ethical, and excellent communicators. A good competitive personality wouldn't hurt either.